Hey manual therapy friends, it's Dr. David here from El Paso Manual Physical Therapy. We're going to do a lumbar gapping or rotation manipulation. So we're in the same setup as a side bending mobilization like I showed you in last week's video. What we're going to do here though is just we're going to put our thumbs in different places. Our leverage is going to be different here. So you're going to grab onto your wrist just like so. Same setup right here. I'm getting that arm relaxed there. And you have to know which area you're going to target. So this is where I differ a bit compared to some of the students that come through that know this already, is they'll just get to here and they'll just go for it and things will cavitate. But you have to realize that they may be missing the spot that needs it the most. So if you can identify which segment is most stuck and focus your force on this manipulation through that most stuck segment, then you can be the most successful. You might still be leaving joints that are stuck if you just go through a general manipulation. So we're gonna do a specific manipulation here. So let's just say we're gonna target, well, let's just check real quick because we might find something that needs to move better. Yeah, definitely up in the TL junction. It's about L1, L2, that's more relatively stuck. I don't know if it'll pop though, he's actually pretty mobile throughout. But let's show you the technique. So now my thumb on my left hand, my cranial hand, is going to be on the left side of the spinal process here. That is to pin it down. So I'm pinning it down right here because everything else below that, L2 right here, I'm going to pull over this way to create a quick rotation in the spine. I have to use my right leg here. I'm bending my leg to drop down. I'm also side bending in my body. That's what's going to create the force as I have a right rotation moment in the lower back here, as well as dropping my leg down so that he's pulled into some side bending simultaneously. So once we're set up here, I'm going to put my weight on him just to stabilize and get my body in the right position. So I'm pinning down L1 right here, winding up the slack. I like to do some test moves like this, not for two purposes: for the patient to kind of get comfortable with the motion as well, and for myself to assess how much thrust I'm going to give based on how much mobility I feel. So once I line it up, then we're going to thrust. That's it. Make sure with your ulna you're not cutting into the glute because your ulna can get pretty pokey on people. One little technique that I like to do is I'll kind of tuck in my elbow but slide my forearm tissue here, my soft tissue, against the hip so that it kind of pulls my tissue over the ulna, so that makes it more comfortable on the hip there. Good, make sure you're comfortable there, get off the edge. Guys, I hope that helps you out. If you're looking to do rotational manipulations in the lumbar spine, they can be very effective. But just a heads up, they can also be kind of dangerous. If you find somebody that's got a hypermobile segment in their lumbar spine and you're doing big rotational manipulations like that, it can aggravate the problem. I often see patients that visit the chiropractor, which they do this kind of technique quite aggressively in some cases, and they'll have the experience, the patients will have the experience where they come back and they'll say, you know what, the chiropractor helped initially, but of course I kept going back for adjustments over and over and over again, and then it started getting worse. And my suspicion is that they were very stuck at the beginning. Chiropractor freed that up. Good job, chiropractor. But then at the end, they kind of overdid it to them, and they didn't teach them any stability exercises. And that's what's needed for those hypermobile segments. Hypomobilities, all day, let's mobilize and manipulate. But hypermobilities, we got to be careful with how we handle those. We don't want to overstretch them. So I hope that helps out. If you have any questions, I'm happy to help. Thanks. Bye-bye.